The literature reflects that likely the greatest amount of serious accidents that have occurred with manipulation to the cervical spine have occurred due to tearing of the V3 segment of the vertebral artery. The V3 segment of the vertebral artery starts as it makes its exit from the transverse foramen of the C2 vertebrae and as it enters into the transverse foramen of the C1 vertebrae. The V3 segment can be overly bent and overly tensioned with any type of rotational high-velocity manipulation applied through the head and into the upper cervical region. Our goal for stretching the upper cervical region and our target tissue should be the facet joint capsular tissue. This is the tissue that would stiffen. And we can very nicely stretch the facet joint capsular tissue at the C0, C1, and at the C1, C2 motion segment with purely traction. There's no change in the lumen diameter of the vertebral artery, no bending loads to the vertebral artery, and much less tensile loads applied to the V3 segment of the artery. So let's stay away from any type of manipulative procedure that twists the upper cervical spine. Let's keep the V3 segment safe, and we're going to do that by just applying a traction manipulation to the upper cervical region. The patient will be in supine. We'll take a very gentle grip under the head and a very light contact on the patient's chin. Our manipulation hand contacts the mastoid process, which is just below the ear. We take up just a little bit of slack with our non-manipulating hand in the direction of traction and give a short, quick impulse to separate the facet joint on the side of the manipulation. In order to stretch the C0, C1, and the C1, C2 articulations on the other side, the manipulation would have to be applied bilaterally. This is the safest way that we know of to address facet joint capsular shortening with a manipulation in the upper cervical region.